Greetings. Welcome to this webinar, Coping During COVID, Strategies on Managing Stress for Faith and Community Organizations, Emergency Managers, and First Responders. My name is Nicole Wood, and today I will serve as your moderator. On behalf of the Department of Homeland Security Center for Faith-Based Neighborhood Partnerships, we welcome you. And reflecting on the impact of COVID-19 over the last year and a half, there's been a major shift in how we related to one another. From once seeing smiling and faces and giving warm hugs to wearing masks and other personal protective equipment, to even being separated from loved ones and losing countless precious lives. During the beginning of the pandemic, American poet Amanda Gorman wrote a poem called The Miracle of the Morning. We were only beginning to comprehend the scale of the national mourning yet to come of lost lives. But even then, she wanted to acknowledge the promise of healing. And in this poem, she states, while we might feel small, separate, and all alone, the question isn't if we can weather the unknown, but how we will weather this unknown together. Show us how to find hope if we lose it. So ensure that this ache wasn't endured in vain. Do not ignore the pain. Give it purpose. Use it. End of quote. In our hurt, there is hope. And out of hope comes healing. To commemorate Mental Health Awareness Month, this webinar will address the social and emotional impacts associated with COVID-19 among communities of color and various faith traditions. The intent of the webinar is to present strategies and or resources that will be applicable to all in attendance. Lastly, and importantly, while 61.5% and a growing number of Americans have had at least one vaccination, it is important we not forget about the numbers. There are 32,947,548 lives who had and or are living with COVID in the United States. And of that number, 587,342 lives have been lost as of 8 p.m. last evening. Let us take a moment of silence to remember those we have lost. Thank you. And let us begin. Next slide. I'm excited and looking forward to hearing from our presenters today during our webinar, as we will hear from Dr. Anel Prim, Dr. Jamie Eaton, Dr. Farha Abbasi, and Rabbi Brian Kisbruner. Looking forward to all that they have to share, and certainly we'll do our best to respond to any questions at the Q&A portion. At this time, we will now welcome our first presenter. Please allow us to welcome Dr. Anel Prim. She's a Baltimore-based community psychiatrist who is chair and of All Healers Mental Health Alliance. Welcome, Dr. Prim.
Thank you, Nicole, for your kind introduction, and good day to everyone. Next slide, please. I'm Dr. Anel Prim, and I serve as the chair of the All Healers Mental Health Alliance, which is a group that facilitates culturally appropriate long-term responses to the mental health needs of marginalized communities in the aftermath of natural and human-caused disaster, from Hurricane Katrina to the Flint water crisis. Next slide, please. I'd like to set the stage today to talk about the COVID-19 pandemic as an unprecedented disaster that has had a catastrophic impact on the whole nation, but in particular marginalized communities, given that it has been superimposed on layers and layers of inequities in the social determinants of health. Next slide, please. When we look at the impact of COVID-19 on communities of color, we see that people of color have had high infection rates and mortality rates, leading to a great loss of loved ones and grief at much higher levels than the rest of the nation. Family members have also experienced disparities in that they are more likely than other groups to be essential and frontline workers. And this means much greater exposure to the coronavirus and greater risk of contracting the illness. There's also been disproportionate financial adversity due to the high rates of unemployment in communities of color, as well as the negative impact on small businesses. Next slide, please. There have also been racial attacks against people of Asian descent, where they have been inappropriately blamed for the pandemic. And then in the medical setting, there have been concerns about the risk of medical decision-making and COVID-19 care being biased and based on people of color with a poor prognosis, given the disproportionately high rates of chronic diseases like diabetes and so forth. Indigenous communities have also experienced disparities in access to health care, as well as utilities that would help them be able to protect themselves against COVID. And then undocumented families needing COVID-19 care have been afraid to get help due to their immigration status. Next slide, please. There are other issues that come into play here that disproportionately affect communities of color. For instance, living in crowded conditions with multi-generational households. This, especially in the earlier parts of the pandemic, increased risk for infection and transmission between family members. And then when school closed and online learning kicked in, this placed additional pressures on families, especially around childcare, given that members of communities of color are less likely to have jobs that allow them to telecommute. Next slide, please. There's also been the issue of high-speed internet and the lack of access to it, especially in some urban communities as well as rural and remote communities. And this interfered with students being able to complete their assignments and keep up with their studies. On top of that, students have been disconnected from their friends very often, unable to see them. This has caused social hardship, sadness, and frustration at a time when social connection is so important in terms of young people's development. And unfortunately, some children have been unsupervised because their family members have had to work. And if they did have access to online, often this was a risk for them to be exposed to sexual exploitation. The impact of COVID-19 on mental health has been significant. First of all, we've all been advised to stay, quote unquote, socially distant, 6 feet apart from each other. But many of us in the mental health community have preferred to refer to this rather as physical distancing, because while we need to be apart physically, socially, we really needed to be conscious of staying connected, even if that was not in person, using whatever technology we had at our disposal, including the telephone, to feel connected with others. As we know, social interaction is such an important part of human existence. We are indeed relational creatures, and we thrive on that, which is why social isolation, especially among those who live alone and some of our seniors, is such a big issue and has really dictated that we be conscious of those in our communities who live alone and may need additional support. COVID-19 has certainly increased anxiety, depression, and stress throughout the nation, and it has also been associated with changes in behavior in some of our children. For instance, they may have shown an increase in irritability or exhibiting behaviors that made it seem like they were going backwards in time in terms of their development. There have been elevations in intimate partner violence, child abuse, as well as substance use disorders. And we've also seen an increase in suicide, particularly among young people of color, particularly young Black males. And this was a trend that had begun prior to the pandemic, but has continued, sadly. In many ways, some of the racial trauma that people of color have been experiencing, given the racial reckoning in our country, combined with the COVID-19 pandemic, really this could be called a syndemic of these two parallel pandemics occurring simultaneously. And the succession of violent deaths that we've seen with Ahmaud Arbery, Breonna Taylor, George Floyd, Rayshard Brooks, and others has really resulted in a collective trauma on people of good conscience across the nation. And there's been anger, stress, and fear and worries about safety and risk of death as a person of color. And this is in conjunction with all of that anxiety and fear associated with the COVID-19 pandemic. Next slide, please. There have been some actions taken by groups like the All Healers Mental Health Alliance and its partners post-COVID. For instance, the Institute of the Black World, Black Family Summit, developed a community cares listening line for essential workers to have access to support and resources via telephone 24/7. And then also we've developed a guide on how to advocate for hospitalized loved ones when we could not be physically present. And then COVID-19 testing in communities of color around the nation to make sure those resources were available, as well as information on a host of different issues, domestic violence, education, FEMA resources, and also COVID-19 vaccination to reduce vaccine hesitancy. Next slide, please. Some of the action steps for individuals and communities that I've engaged in and the people that I work with have supported include, being patient and flexible in the midst of all of the challenges that we were all facing. The importance of staying connected with friends and family by whatever means are at our disposal. Engaging in trauma-informed self-care and being very conscious of taking care of ourselves in whatever way we need to, making sure we get our rest, making sure that we eat properly, stay hydrated, and stay active in doing those things that bring us joy, being mindful and staying in the moment, and limiting our exposure to violence and disturbing images in the media. And most importantly, looking out for others. Instead of us feeling helpless, being helpful is often a way of bringing us calm and helping us stay grounded. I will stop there. Thank you very much.
And thank you, Dr. Prim. Truly appreciate all that you have shared, and certainly looking forward to our time during our Q&A pod to have further discussion. With that, let us transition to, next slide, as we welcome Dr. Jamie Aiden, who is a psychologist and a disaster ministry expert, and founder and executive director of Humanitarian Disaster Institute at Blanchard Chair of Humanitarian and Disaster Leadership at Wheaton College. We welcome Dr. Aiden.
Thank you so much, Nicole, for the opportunity to be here today and to share with these great presenters. Next slide. So today I'll be talking about spiritual first aid. And one of the things that I've spent my career trying to do is how do we take psychological insights and research and to be able to integrate those with spiritual insights to be able to equip houses of worship to better prepare and care in a disaster-filled world. And so what I'll be sharing today is a basic framework that we've created for a spiritual and emotional care intervention, as well as training, to be able to help take some of the guesswork out of how to provide care to those that have been impacted by both COVID-19 and other disasters and everyday life challenges. Next slide. So spiritual first aid is an evidence-informed and spiritually based peer-to-peer emotional care intervention. And we've designed it to really help others across a wide spectrum of challenges. But one of the important things here is to recognize that we see and have been able to see firsthand about how as COVID-19 has continued, that there's been a drastic increase in overall mental health and emotional issues. And as was highlighted in the previous discussion, that there's a need for social support, and that we know from the research that our team's done across COVID-19 and other disasters and major challenges that oftentimes basic positive social support can go a long way in helping to put people on a more healthy trajectory for well-being over time, to help enhance recovery, and also to prevent some problems from snowballing and becoming worse. So this isn't meant to be counseling, but rather a peer-to-peer. So how can we equip our neighbors or the people in our congregations or houses of worship to be able to help others? Next slide. And just to mention, the model that I'm talking about today, we've specifically designed it in our training for a church-based setting, but we're actually actively working on adapting it as well. So we're actually piloting a project in the state of Pennsylvania, working with the State Department of Health there, and working to develop a more broad general spiritual guidelines to be able to help others beyond just a particular faith tradition. So how does spiritual first aid actually help? Well, it helps by helping engage people to use their faith in positive ways to both improve access to resources as well as to help reduce stress. So for instance, we published a paper looking at over 44 years of empirical studies on religion and disaster mental health. And we published an article in the Journal of Psychological Trauma with the American Psychological Association. And what we really found at the end of the day, it wasn't just how religious a person was that predicted resilience, but more so about how did a person actually engage their faith. So you might have two people go through the same event, but use their faith in ways that may either help cultivate greater resilience or could also hinder it. And so based on this type of research that we've been doing, we've now tried to take some of that guesswork out. So again, this is not a counseling intervention, but rather is meant to truly be like what the name sounds, a spiritual first aid, that we're triaging the problem that the person has in front of us, that we're trying to meet those most basic needs. And this can be used if you have a brief 5-minute interaction to maybe you have an hour. So it's something that's really meant to be able to use to help us to care for our neighbors better. Next slide. And one of the things that we found from 15 years of research that we've been doing in this area has been these, what we've identified and referred to as the 5 core needs that most people have in times of a crisis. Now, if you were to look on my shelf behind me, I've got the latest copy of the Diagnostic Statistical Manual, which is about that thick and requires learning hundreds of different diagnoses and criteria. Again, remember, this isn't counseling, and what we're trying to do is equip the average natural helper that already has a basic sense of wanting to work with others, has some basic skills, and is really trying to create just some basic, you could think of these as categories or funnels, so that as they're hearing problems, they're not trying to diagnose, but rather, is this person struggling with belonging needs? You know, this is their social needs. Maybe they're struggling with livelihood, but could be physical issues or economic related issues. The E standing for emotional, spiritual, and safety. And so we've tried to categorize this in an easy and kind of sticky framework that allows basic and natural helpers a way to understand the problems that they're seeing in front of others. And one of the things you'll notice here too is that we highlight that our research has shown that all of these needs are highly interconnected. You could think of it almost as like a Rubik's Cube, that most of the people that come to us in crisis during COVID-19, you know, they've got each tile, you could probably put a different problem on that they've got going on in their life, which can feel overwhelming to them, but also to us as the helper. But one of the things that we know is that if you can focus in on just one tile, like a Rubik's Cube, what happens? It starts to shift the whole side of it, starts to shift the whole cube, because everything's interconnected. The same is true with the needs that we have in the midst of a crisis. Next slide. And so this is just a kind of a 10,000-foot view of the overall spiritual first aid model. And so what specifically as we dig into it, we teach the BLESS method. And that's our, you could think of it as our both our assessment and intervention framework or strategy. And so it starts first by grounding our help in humility. So this is having a sense of both our strengths and weaknesses as helpers to make sure that we're helping for the right reasons. and that it will help us become more other-oriented. Or if we make a mistake, we'll be more quick to apologize and to be able to meet the other person where they're at. Also, when we take a perspective of humility in helping others by that posture and attitude, that it allows us to recognize the expertise the other person has that we're helping, that ultimately they are the expert of their own needs. So then we begin by providing practical presence. And this is really coming alongside and setting with others in suffering, that we're helping to provide for whatever those basic needs are. And so the goal here really is to attend to them, to be with them, providing social support. And then next, we're going to triage their core needs. So if you remember, the core needs are the blessed needs: belonging, livelihood, emotional, spiritual, and safety needs. And in the same way that a healthcare professional might triage the level of severity a problem is for a health crisis, that's what we're doing with the needs in front of us. What is that one need in this moment that I could help you with? What's one thing that seems to be causing most of your stress? And so we're not trying to fix everything again, but instead trying to help fix something in the immediate and put them on a trajectory to well-being. And so that's our assessment process. And then next, once we've been identified what that need is, we're going to be able, if we could go back one, so what we're going to do after the assessing is pulling from spiritually oriented interventions. And we teach these on a continuum, with one side being spiritually obvious care interventions and spiritually subtle care interventions. So for instance, you can work with someone and maybe the intervention that you're going to be using is providing spiritual support. Well, for you, if you're a spiritual person, that it's coming from that place of motivation for you, but that person in front of you might come from a different faith or have no faith tradition, for example. So you're not maybe going to be explicit, but instead drawing from more of a subtle approach, that you're providing care, but then you may, if that person identifies themselves belonging to a certain tradition, you might refer them then to a house of worship for additional care and support. So again, it allows us the ability across all the different interventions to really be able to kind of move back and forth to meet people with where they're at. And then the last thing that we're going to do is that we're going to repeat this process. So if we have time, again, you may only have 5 minutes, you may have an hour with someone, but we're really trying to boil it down to these 4 basic steps. Next slide, please. So for more information about spiritual first aid, you can visit our website at spiritualfirstaidhub.com, and there you'll find numerous different free resources. So from our 195-page COVID-19 mental health handbook that's available for free, to devotionals that focus on spiritual-related issues on topics like grief. We have a children's book there on how to help them through COVID-19. We also have our manual for spiritual first aid. And then you can also, from that website, be able to find and enroll in our spiritual first aid online training certificate course. Thank you for your time.
And thank you, Dr. Aiden. Truly appreciate all the wonderful resources that you have shared and your long-term partnership with the DHS Center. With that, we're going to transition to our next presenter. Next slide. And we welcome Dr. Farha Abbasi, who is the Assistant Professor in the Department of Psychiatry at Michigan State University and the core faculty member of the Muslim Studies Program and on Cultural Psychiatry. Dr. Abbasi is also the Director of the Muslim Mental Health Consortium. We welcome Dr. Abbasi.
Thank you. Thank you so much for including me with these esteemed panelists. And I can start my presentation if we can go to the next slide, please. So today I want to talk about COVID-19 from the perspective of Muslim community. What I want to focus on actually is what Dr. Prem and Dr. Aiton kind of outlined, is the stressors, how we share the common stressors, and kind of we share the similar coping skills. So I did feel for Muslim community, the faith is always very central and integral, but going deeper into our faith became our source of coping and resilience. So next slide, please. So just a brief outline, American Muslim make up about 1% of the population, but the point that I really want to focus on is that almost 1/3 are living below poverty line. And they are very diverse, so intersectionality is important. So if you're talking about Black population and the struggles, then of course a lot of them are Muslims. So Black Muslims make a majority of are Muslims in the country. Or if you're talking about Latinx or DACA or recipients, then also they could be of Muslim faith. So I want to focus on the intersectionality of the struggle. Next slide, please. For the last decade has been really hard for Muslims in general. There are more Muslims being killed on hands of terrorists, and in war on terrorism, more are being displaced and are under a lot of trauma already. On top of that, of course, the same struggle here in the country. A Muslim family unit is multi-generational, and that got really impacted. So what we know that the density of living together in closer spaces make you more vulnerable to COVID, as Dr. Prem mentioned. But also, if you look at the major conflicts in the world right now, they are impacting most of the Muslim majority countries. So that trauma being the vicarious trauma, and then the trauma of the intergenerational trauma being transmitted. We also saw the disruption in the religious and spiritual practices because of the COVID social isolation policy and how it impacted the community. We will talk about that. Next slide, please. So it is, when we go into the spirit of the religion, we realize that the Quranic verses constantly talk about how you will be tested. So we know historically there has been a pestilence, there have been epidemics. So that served as a good social model for us to apply those principles of disaster, how historically communities have dealt with it and prevailed. So these are some of the verses, Quranic verses, that talk about it, that we will surely test you with something of fear, hunger, loss of wealth, lives, but give good tidings to the patient. So the concept that the testing happens, that the disasters will happen, but that you have the agency, you have the resources to prevail. We can go to the next slide, please. So especially when it comes to pandemic and epidemics, there are very clear historical narratives that we could take into account. So especially we hear Prophet Muhammad say that if you hear of its presence, the presence of plague in a land, don't enter it. But if it spreads in the land where you are, don't fly from it. So we already have the concept of quarantine. So it was very easy for people to understand that why quarantine and social distancing is important. And also not to feel overwhelmed or helpless that the Quranic verses said that Allah burdens not a person beyond his scope. So also constantly with the struggle, there is a message of hope that is resonating throughout the verses, which says with every hardship there is ease, and every conflict or struggle is also a point of growth. So basically, these are the basic tenets. And I think when I see the response of the community, I see them using these to use it for their wellness and resilience during this hard time. We can go forward to the next slide. So these are the three integral concepts I really want to focus on. So these are the three integral practices in Islam. One is wellness, which starts with your own self-care, how you take care of yourself, how you then it ripples into how you take care of your family, and that ripples over how you take care of the community and the larger society. So every step of wellness then goes into welfare. So welfare in these hard times translated for us as like what could we give back? Is it our time, talent, or treasure? how we can develop these resources. So philanthropy being a very essential part of our religion, it also, we saw that in this time, this philanthropy really not only helped those who were living in poverty or were being destitute because of this, but it also helped with how we all started using our talents. Like if you were a physician, teacher, we were started thinking outside the box that how can we continue to give back to the community as well. So we can go forward. These are some of the statistics collected by Institute of Social Support and Policy. So we realize that Muslims do make a large segment of the frontline workers. So a lot of them get really impacted directly. Lost of physician, lost their lives, but also we had to take on the burden of taking care of the loved ones and the community in the larger sense. So in Michigan, 15% of doctors represent, Muslims represent 15% of the doctors and 11% of the pharmacists. We can go to the next slide. Same way we see teachers and administrators had to step up. So like in New York, 10,000 or was close to 10,000 were teach 250,000 students each year. So how did they had to use virtual resources. They had to develop more resources to continue working on these lines. We can go to the next slide. But this is very important that 61% of American Muslim believes that poverty is caused by societal circumstances. And 81%, when they do give back, they are not only thinking of just the faith community. They do like to give to charity and serve the bigger community. But of course, the faith leaders were really feeling the pressure of not only keeping the community together, but how do we continue to practice a faith that really depends on being in community, practicing in community. So a lot of it was taken over virtual sermons, virtual prayers, but we also went through month of Ramadan. And that really impacted, or we couldn't even go to, and we can go to the next slide, talk about it, like going to Hajj was disrupted. So typically more than 3 million Muslims perform Hajj annually and visit Makkah, but we couldn't do that this last year, and limited numbers could do this year. So that was a big disruption for the community. But then same thing, the drive-through food distribution through Ramadan, the online sermons, online prayers, and then when the vaccination started happening, then limited opening of Islamic centers, that all helped. Go next slide, please. I think another thing I saw very well done was the community organization that happened. So immediately National Muslim Task Force on COVID-19 was constituted, and it represented 40 different national and at different level professional, health professionals, other professional, business professional. They all came together and had a very inclusive plan how to focus on that. And another thing we had to do was the work on the vaccination hesitancy. So how we encourage the community to get vaccinated. We had to dispel the belief that the vaccine might have poor products, or the fact that if you are fasting, you cannot get the vaccination. So a lot of comprehensive work was done by faith leaders and physicians and mental health providers all coming together to dispel this. And that's why we had a very high rate of people getting vaccinated against COVID. We can go to the next slide. As soon as the shortage of PPE supplies was identified, a lot of groups took it on themselves to really contribute at multiple levels. So again, giving back from small individual level to organizations stepping up. So we saw a lot of people working on specific areas as well So provision of food to safety, to creating more PPP supplies, to if you were teachers or physicians, by doing virtual teaching, virtual webinars, virtual mental health services. And so it was like a very comprehensive network. We know that one of the vaccination that did come out, the first vaccination, was by a Muslim researcher. Then also their pioneer services, woman-owned manufacturer, they kind of innovation outside the box, like how can you use PPP longer? How can you sterilize more PPP? And so all that concepts, research, science, everything was applied for the benefit of bigger community. We can go to the next slide. I think mental health being my area, I would like to talk about that I think a lot of tools and kits are developed, keeping the cultural needs and the faith-based needs, keeping that in mind. And I would recommend if you check out Family Youth Institute has developed a lot of toolkits. Muslim Mental Health Consortium, we did like almost like 50 virtual webinars locally, globally, talking about how to take care of yourself, how to become intentional about it. I think another highlight was Dr. Mona Masood created physician support line. So this wasn't only for Muslim providers, but for all providers, how to take care of your own self. So I think a lot of work was done in mental health, but I think what was really the highlight was how we brought the faith and culture and mental health practices together and provided those support and toolkits to the community. Next slide, please. So quickly, I want to talk about, mention about the growth and the trauma healing. So I think one thing we learned early on that we have to be very intentional about not only our health, but those around us, and about and keeping those community communication going was very vital to this. So take wellness, taking care of yourself, taking care of your family, welfare, wellness to welfare, how you go beyond your own unit, how to take care of others around you, but how to stay in community, in Ummah. So even if it was a virtually we were keeping these communications alive, but we were still thinking in terms of the broader, like how not only take care of ourselves intentionally, be it our physical, mental health, emotional, spiritual, or ethical issues, whatever, how to start with one unit, but how to keep the bigger context of the community in perspective. So every action was starting with one and flowing to the bigger community benefit. There are still areas that I think we need to continue to work on trauma-informed care and healing, especially those who are impacted financially as well and have lost loved ones. They will need a long time sustenance and support. So I do hope that as we start to transition back to our everyday life, we do not forget or that we continue to take care of those left behind or deeply impacted. We continue to nurture them as we continue to move forward. So hopefully I can answer some questions.
Excellent, and thank you so much, Dr. Abbasi. I truly appreciate your perspective and all that you shared, especially with your expertise within the Muslim community. Thank you so kindly, and we look forward to you joining you as well during the Q&A portion of this webinar. With that, we are welcoming Rabbi Brian Kisbruner, who is a chaplain who serves as the president of the Nishama Association of Jewish Chaplains and the director of religious and spiritual services for the Oscar and Ella Wolf Campus for Senior Living. We are certainly welcome and glad to have Rabbi Kisbruner. Welcome.
Thank you, Nicole, and thank you to all my fellow panelists. this is our last section where we're going to speak about coping during COVID from my Jewish and chaplaincy perspectives. And I'm going to speak much more from an experiential point of view than statistics and raw data, because I think that that really speaks to what many of us have gone through. If you go to the next slide, just very briefly, I just want to introduce you to the Najc, Nishama Association of Jewish Chaplains. Just so you all know, the word Nishama can be translated, it's a Hebrew word that means either soul or spirit, depending on how you translate it. And we are the professional organization of Jewish spiritual care specialists that provides for education, training, and certification for our Jewish chaplains. And we work very closely with a variety of other chaplaincy organizations to educate across the board. If you go to the next slide, just very brief, this is where I work, the Wilf Campus for Senior Living, which includes an assisted living, hospice care, senior living, transportation. So very much I've been in the midst of the actual day-to-day of COVID at the early stages of this and the aftermaths thereof. If you go forward, just a brief overview of where chaplains serve. And really the truth is we serve in all different settings, hospitals, long-term care, hospice, and so on, as you can see. Chaplains, whether Jewish, Christian, Muslim, of other faiths, it'll take us long to name them all, serve people across the spectrum. We are trained to serve everybody. So in general, when we provide for spiritual care, we're providing really an interfaith model of spiritual care from both one's own faith tradition as well as looking broadly into the general faith traditions of those whom we're caring for. That played a very big role in this era of COVID because we really, all chaplains across the board, had to, when we pivoted to do the work during COVID-19, we had to really be focused on a variety of different areas for those whom we cared for. If you go to the next slide, just to give you a couple examples of what chaplains did and why I think that actually extrapolates to what people can do for one another. The chaplains in many healthcare settings and in other settings as well really became a fundamental really became the fundamental people to provide for staff support for their colleagues. In the hospitals, there are many articles over the year that were published about chaplains providing the care for the nurses and the doctors and the aides and the medical technicians, etc. One of my Jewish chaplaincy colleagues recently described how they provided food carts around the hospital, providing people just a little bit of physical nourishment in addition to spiritual nourishment. For many chaplains, we became the surrogates for the families who weren't allowed in. And you can only imagine the burdens and the pressures of what that meant to chaplains and really to all staff. And we're going to come slowly to how do we support that going forward. And third and foremost is when you have to pivot during a pandemic, you have to learn how to use new skills. And very much many of us in the chaplaincy world had to learn how to become chaplains through electronic means, telechaplaincy like telemedicine, telehealth, and so on. I highlight that element because it took many of us out of the comfort zone of literally sitting by a bedside or sitting across from a person to provide that spiritual presence and care that is really part of what spiritual care, what chaplaincy brings to the table. In terms of the Najc, and I give you just this overview about how we supported each other and outside, is we realized very quickly that in order for our chaplains to do the work they needed to do, we needed to support them better. And so we created support groups, both general support groups for chaplains, for our chaplains, and then specific groups depending upon where they work, long-term care, hospitals, community, military, prison, because we knew that there would be unique things to each one of those groups. And again, how do we support each other is we come together. We don't do this alone. We're not in a vacuum. Provided webinars and education, please leave the slide for just a moment, and resource page on our website. Our fellow chaplaincy organizations also did the same because we all knew that we would be working together as well. And as you can see, we did a lot of work externally too, saying we have a lot of skill to provide for our rabbinic colleagues, our professional colleagues who do human service work through different agencies, supported an organization that was providing volunteer emotional support, and really shared resources with one another, and really concretized spiritual care support across the board. If you go to the next slide, the next two slides, this one and the next one, very brief. People have been asking about self-care, and one of the things that I would say about self-care is, for many, is writing, reading, and engaging. And during this era, there is a lot of writing that has been done. And in 2020, 2021, we have self-publishing, so it makes getting writing out so much easier. And as you can see on this slide, there are 4 books that were very much about reflecting on how to do spiritual care, and also just how we all live during COVID. If you go to the next slide, just as well, you'll see these are just a few works on Jewish legal issues that came up. What did it mean to shut down a synagogue? How did one go and visit with somebody during the first week of mourning after someone dies? If you go to the next slide, you'll see the terms there. We'll touch on that as well. Oh, sorry. It's actually 2 slides ahead, but that's okay. Another way of support, that's fine. We'll leave it there. We can skip the other one for a moment. I'll go back to that. I went around. So another way of support was, how did we shift our rituals online? How did communities become communities without walls? These are COVID responses, I say, in the Jewish community, but in all of our communities. How did people celebrate weddings? How did people mourn? How did people remember their loved ones at the time of death? What did a religious institution look like? And if you have certain restrictions on how one operates, so for example, in Orthodox Jewish community, we're very strict about not actively using electricity on the Sabbath and the holidays. And so we wouldn't use Zoom. What did it mean to open up a synagogue as soon as one was able to, versus staying on an online model longer? When do you return in person versus when do you stay out? And actually, that's still going on till today as things are opening up more and more. What does it look like to create a hybrid internal institution of mask wearing, not mask wearing, vaccine, unvaccinated, all of those different pieces? What do you do with financial challenges? How did organizations shift the way that they use their money to support those who are out of work, support the community, support healthcare institutions? And if we go back to the previous slide just for a moment, one example from early in the pandemic was an organization called Kosher 19, riffing off of COVID-19, which provided food to healthcare institutions throughout the United States, kosher food, to support all staff, and provide them a little bit of nourishment, because when you're working 12-hour days in a hospital, you're not taking time for yourself. And we've all seen those images from those first few months. People, and the second wave and so on, people were giving of so much of their energy. This was a little way to give back. How do we take care of each other? We take care of each other, and we step forward, and we do it in any way possible. Time, money, volunteerism, our minds, our bodies, and our souls. And just to conclude, I think we're still trying to figure out what that all looks like. I think that each and every one of us has our own strategies, and I think that each and every one of us, personally, professionally, are continuing to try to mine this time where things are opening, but yet, what do we do next? So if you go 2 slides forward, just to share with you, this is our contact information at the NAJC for more resources, for support. If anybody of you on this call needs just a little bit of TLC, please reach out to us. We are here for all of you. Thank you very much.
And thank you so much, Rabbi. We truly appreciate what you have shared and the resources that you're providing, even providing resources for those here who are attendees to reach out for further support. With that, we're going to transition to our next slide. Just want to highlight some resources before we get into our Q&A, where I will invite all of our panels to come back on. Just want to first share with you all that we have resources that you all can use that are free and available. In particular, the Disaster Distress Helpline. I'd like to highlight that it's not just for disasters that are natural and or human cause, but they also provide as it relates to support, in particular as it relates to coronavirus pandemic, incidents of community unrest and other traumatic events. So want to know that the resource is available to all, in addition to the National Suicide Prevention Lifeline numbers. So those two numbers are there. And of course, anyone experiencing a medical emergency, we certainly want you to contact 911. With that, next slide, we want to go ahead and go into our Q&A. Again, I welcome all of our presenters to come back with their videos. I'm glad to have you all back, and I'm certainly grateful for your level of expertise and your time that you've shared. Equally want to thank everyone who sent questions in advance. We are going to focus on those questions now and really to pay attention to that. We're grateful for those who sent questions during the webinar. We certainly will do our best to highlight and focus on some of those key common themes that we've seen. But to kick off the first question, in my time and connecting with persons, many people are having a lot of anxiety about returning back to what we call the new normal, if you will, or some folks don't like that term, or the new way of life might be a better way of putting it, because they've had a slower pace over this last year and a half. And so a lot of folks are really asking and seeking, can you provide some really important ways how we can be more emotionally ready for this new way of life? And if you could just provide some resources that might be helping in coping strategies. So again, I open that up to any of our presenters if you just want to provide some context, and then we'll continue from there. Anyone?
I can, Dr. Abbasi, I can start. So from mental health perspective, I would say that we should do it in small steps, small increments, like don't try and just take it on in like full blast. Like, so small example, just for a lot of us, even doing groceries had changed, right? We were ordering curbside or we were having them delivered. So maybe going there for 5, 10 minutes, 15 minutes, pick few things, get acclimatized again. Or if it is a campus setting, or if you're going back to your offices, then also doing it in increments. So stay there 15, 20 minutes, take breaks, go to use deep breathing, to use guided imagery. Guided imagery simply means closing your eyes, taking deep breaths, and taking yourself to where you feel comfortable. So mentally, you are taking yourself to a place where you feel comfortable and not overwhelmed. Taking deep breaths and being intentional about it. So don't feel like, oh, I am the only one feeling this way and I have to push myself. Be gentle and generous and giving to yourself right now. It is a big change that's happening. Especially I'm noticing a lot of road rage, people getting frustrated by coming back into traffic, and our tolerance levels have gone down. So being cognizant of that, being patient, not only with yourself, be patient to the people around you. So my first strategy is do it in increments. Like, you know how they say, how do you eat an elephant? One bite at a time. So just exposure, then desensitization. Exposure to whatever environment you are going back to, and then taking deep breaths, taking a break, walking, stepping out from the situation. So.
Excellent. Thank you. Thank you. My next question is for Dr. Prem. How can I identify the emotional impacts associated with COVID-19? And how do we know if our behaviors are due to emotional stress? And how can I begin to address them? If you could provide some insights.
Certainly. I think it's important for people who know themselves to be cognizant of how they may have changed in terms of their emotions, the way they express themselves, and maybe even sensing that they're more irritable than usual or feeling more anxiety than usual. And if you're not aware of that, sometimes a way to find out is to ask the people who are around you, because they may be able to point out the ways in which you respond to your environment or engage in terms of relationships have changed. I think once you become aware of that, utilizing some coping skills, for instance, mindfulness meditation is something that I think a couple of us have touched on, maybe not using those exact words, but really being in the moment with ourselves, being very conscious and very intentional, being flexible, being accepting of what is happening in the here and now, taking the time to practice relaxation techniques, using certain breathing exercises. Dr. Abbasi mentioned guided imagery. This is another thing of deliberately focusing on positive thoughts and not letting ourselves drift to some of the more anxious or fearful thoughts. These are some of the things that help our bodies, our minds get into alignment and help to reduce our stress levels. Instead of just the hard driving, kind of forcing ourselves. I think it's really being gentle, conscious, and intentional about how we approach the things that are in front of us. And by taking that approach, it really takes a lot of the pressure off and allows us to, ease into the situation that we are handling. And in many cases, this issue of, post-traumatic growth, we are able then to really learn from the adverse challenges that we're facing and come out more whole and more calm, centered, balanced, and grounded.
Excellent. Thank you so much. And I truly appreciate that and your insights. To Dr. Aiden, we have a question, and particularly for those who are serving and working in emergency management or even first responders. The question is this, Dr. Aiden: how do you address concerns on how to manage stress during a hurricane or other man-made or human-caused disaster for those who are emergency managers and or first responders, and even for the survivor? The person didn't provide an example, even maintaining social distance while evacuating to a shelter, not knowing who may or may not, have COVID. If you could just provide some insights, we would certainly welcome
Sure.
it.
Well, I think especially those who are participating today from the emergency management community, and really all of us, no matter what our professional background is, that we've all been operating at a very high level, and it's been quite taxing. And times where I've gone to like a self-care workshop, and by the time it was done, there were so many things suggested that I realized that if I was truly going to have balance, that I was now out of balance automatically because I didn't have enough hours in the day to be able to do everything. So one of the things that I'd recommend is exactly what the other presenters have been sharing today, which is start small, have self-compassion. And oftentimes, rather than thinking about how do I have the perfect balance, I encourage others in emergency management to often thinking about their work much more in terms of surfing, that it's okay to have these busy times where you ride a crest of busyness, but know and listen to your body, listen to when you start to feel stressed or how it's impacting relationships, when you might need to come down off the wave a bit or just get back out into the calm waters and kind of doggy paddle, or maybe it's even time that you get completely out of the water and go back to the sand for a little while. So make sure you're listening to yourself, that you're learning to pace and focus more on healthy rhythms than having the perfect balance.
Mm-hmm. That's excellent. That's excellent, and excellent guidance that you all shared. And I just certainly want to hear with our remaining time, before we have our polling questions, I do want to hear from Rabbi Kizbruner. And this particular question that was shared with us, one of our attendees, is that how should one handle stress linked to personally or witnessing loss, which could include the loss of their income, loss of debt, their social and physical connections, and even coping strategies. If you could just provide some insights, that would be welcomed.
So I'm going to stick to where I'm more the expert, which is really the death and the witnessing loss in general. I guess the way I would put it first and foremost, we speak of this in chaplaincy and in mental health, of course, is naming it, naming your losses, naming your pains, both in the sense of if you're feeling angry, you're feeling angry. If you're feeling frustrated, that, a lot of people feel the anger of my loved one died alone. Say it. It's true. Obviously, we can't control everything, but it's truth. And I think if we name our pain, that's the first step. Number two is I remember when I was training years ago for chaplaincy, know where that pain is physically, because sometimes our emotions, many times our emotions are manifesting in our physical feelings, stomach, chest, shoulders, neck, et cetera, et cetera. Know where that is. And number three is use the rituals of your faith if you have. Find ways to adapt those rituals if you haven't yet. I'll give you just one example of how that would look. So many people had funerals with maybe a couple people in those early days. Again, a lot of these things have changed in these months forward. And so in the Jewish tradition, for example, many people have a custom that they gather together about a year after the death to do what they call an unveiling, which is sort of it's sort of taking, in a way, unveiling the headstone. It's already there, but you do a little bit of it's prayer and reflection. Make that into more like a funeral if you didn't have the funeral. That's just one example, one little iota, if you have that opportunity. Don't just say, oh, well, I missed it and therefore. No, you always have opportunity to do new, and to grieve and to mourn. There's going to be a lot of delayed grief. I think if you ask any of our panelists here, we all are starting to see it if we haven't seen it already. We were so inundated with one piece that we didn't have time to grieve. Grieve. Take the time if you didn't already. That's just a couple of pieces. I think that every one of these questions is so much more to say, but that's just a little bit what I would offer on that.
No, I appreciate what you shared, Rabbi, and truly appreciate all of our presenters, their level of expertise, all the information they have shared. I've truly valued. I don't know about all of you, but I know I've gained so much more from learning and listening from each of you. And the other piece that I'm very excited about is that we'll be able to share this recording with all of you. I know that many have asked that question, so you will have access to the recording. I'll go to the next slide. Before we do, I certainly want to launch this polling. We welcome your feedback from all those who have joined us today. Let us know how we did. We certainly welcome to hear that. And also, as you notice, there are ways in which you can stay connected to us. So feel free to reach back to our office. And again, we thank you for your time and for staying just a couple minutes over as we want to wrap up our time together. Again, thank you for your participation. Thank you for your time, and certainly look forward to staying connected for future events. Take care, everyone, and have a safe and enjoyable day. Bye-bye.